Bismillah ar-Rahman ar-Rahim. Hello my friends and my colleagues and my fans everywhere, all doctors who listen to me, and healthcare providers who listen to me. Again, to continue, I was talking about the clinical evaluation and the clinical assessment of a patient presenting with a fever or acute febrile or chronic febrile conditions generally. Because as I mentioned, there is a category, we call it acute febrile illness, that is a patient presenting with fever of recent onset, less than 2 to 3 weeks, and we have a fever of unknown origin or pyrexia of unknown origin, which is chronic recurrent fever lasting 3 weeks or more, and of unidentified or unknown underlying cause. The cause is not yet clear. And we have given time for any popular viral respiratory infection to take its course and should have improved by this time, because if it lasts more than 3 weeks, it's sure not a common viral infection. The common viral infections which cause acute febrile illness, they resolve within short time. They are usually self-limited and run a short course, several days to 2 weeks maximum, and then they disappear. If lasting more than this, we have to search for the other more serious and less common causes of fevers other than the viral, the common viral respiratory infections, which we all know them, like the viruses causing colds and flu or flu-like manifestations. So on physical examination, here we have to focus especially in the chronic recurrent fever, that is fever of unknown origin, or FU or PUO, or pyrexia of unknown origin. We have to, in the physical examination, start by checking the vital signs. Of course, after the assessment of the level of consciousness. Level of consciousness is very important, because some febrile conditions, they are associated with disturbed level of consciousness, lassitude, lethargy, even coma in some severe cases, as I will mention, for example, especially in CNS infections, meningitis and encephalitis, for example, and other more serious systemic infections like in endocarditis or in severe pneumonias, or in severe UT infections or in septicemias, etc. There will be disturbed level of consciousness. So assessment of consciousness, number one. Number two, vital signs. The temperature, and we have to analyze the temperature thoroughly, and we have to have a temperature chart, and we have to put the patient under observation and check the temperature accurately and put a thorough temperature observation chart, which should be explained and which should be accurate and with details, in order to assess exactly the severity or the magnitude of fever, the type and the pattern of fever of the patient. So to assess the severity and the pattern and type of the fever in each individual case, we need to have a temperature observation or temperature assessment chart, which is written by the nurse, and this will be studied and looked at daily and every day, morning and evening, by the observing healthcare provider or the physician who observes the case. This is very important. And then we have to analyze, of course, the pulse and the blood pressure and the respiration or the respiratory rate and depth and pattern. So this is the vital signs. And then after that, we proceed for assessment of the body, general examination, very important. We have to focus in general examination of a patient presenting with fever on the following. From above down, you have to look at the eyes. Very important, the eyes in a fever case. Look for jaundice in the eyes. Look for any pupillary changes in the eyes. Look for any scleral changes, any pallor, any bleedings in the eyes. Examine the fundus for possible CNS cause of the fever. Very important. So the eye examination important. And then we proceed down to the neck. Check for the thyroid, check for the lymph nodes, especially examine the lymph nodes all over the body, because the presence of lymphadenopathy with fever will put us in a direction, or can take us in one way for the differential diagnosis of fever with lymphadenopathy. So assess for any regional lymph node enlargement or generalized lymph node enlargement. Peripheral nodes should be addressed, especially the cervical, the axillary, and the inguinal groups of lymph nodes, and the epitrochlear lymph nodes and the popliteal lymph nodes. These are peripheral, and then after that we'll proceed to the visceral lymph nodes, especially the mediastinal lymph nodes and the abdominal group of lymph nodes, the aortic and the para-aortic and retroperitoneal. These need more investigations, radiologic investigations, to check these visceral lymph nodes, the mediastinal and the abdominal. And this will be in a later stage of examination. But in the physical exam or the bedside, we can just assess the peripheral lymph nodes. As I mentioned, the cervical nodes, the upper and lower, superficial and deep cervical nodes, and then the axillary lymph nodes with its groups, as we all know, and the inguinal lymph nodes, and less commonly the popliteal and epitrochlear. These are the major peripheral lymph nodes which should be assessed and examined in any patient with fever. No assessment of fever without examination of lymph nodes. Lymph node examination is very important in general examination. Then after the assessment of lymph nodes, we look at the skin. Immediately, eyes. In my opinion, the eyes, nodes, skin, very important areas which should be checked accurately in any febrile patient, because the presence of jaundice or lymphadenopathy or skin rash with fever will point to specific category of diseases and will put us in a special list of differential diagnosis which we should focus on in order to, at least at the end, to detect what is the final diagnosis among all of these differential possibilities. So the jaundice with fever category, the lymph nodes with fever category, that is lymphadenopathy with fever category, skin rashes with fever category. Then that's why it's important next to examine the skin. And we all know that the skin is a window to the inside of the body. It is a very, very important window to the inside of the body. It is a mirror to the inside of the body. It is, you can detect many of the systemic diseases and systemic causes of fever, especially by examining the skin. The skin can give you an idea, and what the most important in the skin is the rashes and itchy or pruritic spots or scratch marks or pruritic marks. So the rashes, very important. Examine for rash. And of course, rash with fever, number one, viral infections. There are certain systemic viral diseases which cause specific rashes with fever. This is we call exanthems. So search for exanthematous viral infections causing fever and skin rash. Different types of rashes. This is not my issue now. This deserves a special presentation. Look for any macular eruption, maculopapular, vesicular rashes, pastular eruption, vesiculopastular, other hemorrhagic patches in the skin due to viral hemorrhagic diseases causing PTK, causing bruises. So examination of the skin for skin lesions and rashes as due to especially systemic viral infections can be the clue to the underlying cause of fever, skin rashes. Then after that we proceed also to examination for any ulcers or edema in the lower limbs. We have to look for any changes in the hands, we have to look for any clapping, we have to look for any abnormalities in the skin and joints of the hands, and then we proceed to system examination, examine the heart for any murmurs, for any abnormal sounds, for any gallop, examine also the chest for any consolidation, for any effusion, for any mediastinal problem, as I mentioned, lymph nodes. So listen to the chest is very important. Listen to the heart is very important. Examine the abdomen for organomegaly, and here we come to another category, that is fever with organomegaly. The most important is to detect hepatomegaly or splenomegaly or other abdominal swelling or enlarged lymph nodes. Or even peritoneal fluid causing abdominal enlargement. These are important clues in abdominal examination in patients with fever. That's why we have to examine the abdomen for, number one, detect organomegaly, number two, detect other signs of inflammation and other signs of fluid collection in the abdomen. And then to proceed to neurological examination, and in neurological can give us a lot of clues also about possible underlying conditions, especially if there is inflammatory lesions in the brain and infectious pathology in the brain, for example, causing the fever, if the fever is of neurological origin. And I will have a special presentation about the fever of neurologic origin, both the infectious neurologic and non-infectious neurologic fever, or the neurological diseases causing fevers, whether infections or non-infectious pathologies in the CNS. This will have special presentation. This is how we examine physical examination in a patient with fever. And don't forget the rash with fever, skin rash with fever, lymphadenopathy with fever, jaundice with fever, organomegaly with fever, and fever with other rare physical signs detected on physical examination. The physician and the doctor in charge of fever case should be accurate in history and in physical examination. Thank you so much.